Chinka, who's in charge of admitting people? Yeah, sige. I'm going to just give you the meeting. I'll just chat it to you, Doc, and we'll try it that way. Chinka?
Yeah?
It's RJ is in charge of admitting people to the webinar, right?
Yes.
So is there, like, I don't know what that looks like, but does it like show people's names, and then is there a way like that attendees can be upgraded to panelists, right?
I'm not sure. Isa, can attendees be upgraded to panelists? Ice? But actually,
yes, actually, we can add panelists.
Okay, sige.
Yeah, so can you check if Karen Woolbright is one of the, one of the attendees?
Attendees already.
The waiting room. There aren't any attendees as of yet.
In the waiting room.
Yeah, no attendees.
I think naka-practice mode but sa ako Miss Jack kanang attendees cannot join until you broadcast. Yeah. So we should broadcast na, Miss Chinka?
No.
Dapat hindi pa eh. Pero the problem is
Nick,
Dr. Woolbright cannot enter.
Yeah, can you, Nick, just try and send her another email? Do you have her email? Let me give it to you.
Another link.
Yeah, so that she can get another invitation. Kay Basin, she just got confused.
Okay. Miss Jackie?
Yes.
What Miss Karen can do, diba we have, you emailed us the unique meeting ID and the password. Instead of clicking the link, there's no meeting ID. Maybe she can use this.
I gave her a meeting ID, the one that was in the settings. So I don't know if she was able to access that. I'm still waiting.
Yeah, because we got a link and a password, but not an ID. So also, yes, I think what's that? That's her email.
That's just her email. This is the meeting ID. I have a meeting ID here that's in the info now.
Okay.
But if we want to admit her from the attendees list to be one of the panelists, maybe Nika or Nikki or Miss Jackie can go to the Zoom web portal in the browser and admit her there. Make her panelist from there.
Instead of letting her click a link.
Yes.
Then I will try my PLDT. Maybe she might be having a problem with her internet.
Sa browser, Miss?
She said she's trying her PLDT line.
Sign into the Zoom web portal.
Yeah.
She will click zoom.us?
Yes.
Or Safari browser?
Any browser. Nikki, like what we did last time when we changed the settings there in the
Hi, Doc Karen. Are you
sa settings and then
baka si Nikki is Monica, di ba? Correct?
Yes, Miss. Yes.
So since you're the host, baka you can do that.
Yes, Miss. So nandito na ako sa settings and then I'll
You go to the meetings tab.
Meetings? Okay.
Meetings. And then click the topic that we have, the rest.
No. Si Miss Jackie ang nag-schedule kasi ng meeting. Tama ba?
You can't,
if si Miss Jackie ang nag-schedule, I can't, diba? Kahit ako yung host ngayon.
Kasi this is her
account. I think you can because you can enter as the host. Or you can use the email address and her password. In signing into Zoom.
Kaya lang baka wala si Jackie. Hindi ba?
Ano, ate? Zoom app naman yun. Yung pupuntahan niya po web portal.
Okay.
Okay, sige. I'll try.
I-message.
It says that she needs to be like admitted or something. Is there a workaround for this? Because it's already 4:30.
Yeah, oo nga. We are trying to ask, since Nikki is the host, we are trying to see if she can just add Dr. Woolbright manually using her email address.
Hello, Doc. We're trying to add you manually now with your email. Yeah. So
I'll click the topic, Isa, and then I'll get the
invite. Tama ba, Ice? But if we are going
webinar ID, kasi webinar ang gamit namin, not meetings.
Excuse me, Miss Monica.
Yes.
As you sign into the Zoom web portal, click webinar. And then after you click webinar, click the topic of the webinar you want to add panelists to.
I click
so then go to the invitations tab.
Okay, so it's just
there will be a tab, invitations tab. Then select edit button, and we can invite panelists
manually.
I can't find the invitation. Oh wait.
Okay.
Copy invitation. Is this it?
Yeah, I think.
Okay. I'm gonna just.
But copy attendee.
Wait a second, Doc. Hi guys, can we just send Doc the regular attendee link and then promote her to panelists? Is that an option?
We have to start broadcast so that we can let her in. But I think we can already broadcast because we were able to practice the slide sharing before.
Right. Okay.
We just don't have a backup, but we can go ahead.
Yeah, that's fine. So we can start broadcasting because anyways it's videos now. And then please send me can you send me the link, someone on one of the teams, so I can forward it to Dr. Woolbright. Please send it in Teams so that I can copy and paste and not in the Zoom chat box. The link I will send it to you, Doc, in Viber. Or where can should I email it to you so you can just click it? Yeah. Okay, sige. Okay, I'll email you, Doc. Please stand by and I'll chat you when it's emailed.
All right. So when Dr. Woolbright enters, please admit her, RJ. And
yes,
then
ate.
Can RJ promote her as a panelist?
Yes, ate.
Okay, sige.
And,
so I'll broadcast na, Miss Chinka.
Yeah, Jackie will broadcast na.
Wait a second. Where's the link? Mano yung link? This one is is this the one from your panelist thing, Monica? Nick?
Yes, miss. Gikan ni sa imong account. Invite attendee.
That's for all attendees? Is this the one we sent out for everyone?
Yes.
So Isa can have the slide and the music on standby.
Yeah, so I think you guys can go ahead and broadcast, right?
All right.
I'll turn off my videos.
Okay.
All
right.
So
Isa, please share your screen and play the music. All right.
I'll broadcast na, miss.
Yes. Please broadcast.
And then I'll share it to a live stream na nako, miss, no? I'll live stream na to Facebook.
Yes, yes. RJ,
Okay.
watch out for Dr. Woolbright.
Hi, hello.
Dumantag parok, dumantag sa kasa, mga pagsulay kay lungan gyapunta. Wa ni urungay, wa ni biya ay kari, kung magpapadlong dumantag. Ay kumpiyan sabay, ay kumpiyan sabay, ay kumpiyan sabay, ay kumpiyan sabay, ay kumpiyan sabay. Ay kumpiyan sabay kung di ka gusto mamatay.
Sakit ba daw sa dato, di sa pobre ilang ingon. Di mo takot kaysa daghang kagaw na daw sila immune. Ya okay na daw ka basta maggargulag asin. Bisag magporgat vitamins corona, walay baksin. Mabata o tiguang, way gipili ning sakitan. Yag matakdan ka, matakdan pud nimo imong pamilya mo. Nang nagpailag, nagpadas mga tuo-tuo. Dako pag chance maayos COVID kaysa magka-uto-uto.
Patuo sa mando sa mga nagdumala.
Distansya, higala, distance is love.
Ang naong kamutang naungay gikapa.
Itugyang kahadlok, luwan na babag.
Spread kindness like COVID, stay home to stay safe.
Hold on to the hope, hold on to the faith.
Makahawas, makatindog rin nga kapuhon. Mga kabista, it's all real as one.
Kalbaro, tumantag sa kasa, mga pagsulay kay lungan gyapunta. Wa ni urungay, wa ni biya ay kay, kung magpabadlong ako lungan pamatay. Ay kumpiyan sabay,
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 ay kumpiyan sabay kung di ka gusto mamatay.
Teros di makita, di masumpo, di mo patuo. Ang pagtuman sa balaod nga gimando sa gobyerno. Kay kita man ang medisina, naan nato ang pangontra. Kung naalantay disiplina, masulbad rin ang problema. Pagpuyo na lang sa balay, magpalayo ta sa mga panulay. Sa mga tapok maglikay, kung di ta gustong mamatay. Kaya ragyod sa tinud anay, kung kita'y magtinabangay. Magpakalikon sa pagsulay, gura man yun nga mulabay.
Matuo sa mandok sa mga nagdumala. Distansya higala kay distance is love.
Pangundaw kamutang naungay ikapa.
Tugyang kahadlok to the one up above.
Spread kindness, not COVID, stay home to stay safe.
Hold on to the hope, hold on to the faith.
Magahawas, magatindag, ranya tapuan. Magpapista, all heal us one. Yung sa pamanggi ay ang magtinabang ay di pa.
Kita na.
Kung magkahiusan ang walay kaliso.
Walay kaliso.
Nga di tama kung dungan.
Dungan tagbarog, dungan tagsakasa. Mga pagsulay kay dungan yautang. Wani urungay, wani liyaay kay kung magpabandong ang dungan tamatay. Ay kumpiyansa bay, 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 kung di ka gusto mamatay. Ay kumpiyansa bay, 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 di ka gusto mamatay.
This is the story of a fisherman, Nong Jose. Armed with his bugsai and fishing net, he sets out to sea every day with the hope of getting a good harvest. Day in and day out, he paddles, tireless and hopeful. His family depends on him to put food on the table, enough to last them for the day. The next day, he paddles again. Nong Jose hopes and dreams of a bright future for his family. Nong Jose has fears as he journeys into the sea, for the future brings about uncertainties. So goes Nong Jose, tirelessly paddling to achieve his dreams and realize his hopes for himself and his family. As the bugsai meets the waves, he thrusts himself fearlessly forward. In his journey through life, he knows he is not alone. Kindness exists in this world. Evident in the many happy faces of people around him. Today is a beautiful day. Tomorrow, even better. The future looks bright.
God Almighty, thank you for bringing us together during this unprecedented and challenging time. We ask that as we move forward as a community into the next normal, you give us the strength, patience, and wisdom needed to overcome these trials and rise above the pandemic. We pray for our present-day heroes who are on the front lines fighting against the virus. Those who have become sick and those who have died, may they have eternal rest. For those of us who are holding on to hope, please give us the grace to never give up. Dearest God, heal our land. Amen.
Good afternoon, everyone, and thank you for joining us here today. Welcome to the very first episode of Rafi's Restart webinar series, which aims to provide practical information that will help our community not only survive but thrive in the next normal. So we hope to create an online community where users can be with our resource speakers. So as you're listening, you'll be able to ask questions using our Zoom chat box, as well as by posting comments in the Facebook group. So you'll be able to have your questions answered by our doctor later on in the question and answer portion of the episode. So let me start off by introducing myself. My name is Jackie Clavin, and I work for the Ramona Boitis Foundation Incorporated, also known as Rafi. I'm especially happy that you're here today since it is our premiere episode. The Restart webinar is a series, and for the entire month of July, our webinar episodes will be focusing on topics related to health and taking care of ourselves and our loved ones, our well-being during COVID, and also listening to the experiences of people who have undergone and survived COVID. This webinar series is in line with Rafi's vision of touching people, shaping the future. And we really want to empower our community by connecting virtual with health experts so we can learn how to manage the disease and also understand the disease better as we transition into the next normal. So today we'll be kicking off our webinar series by just going back to the basics. Our episode today is entitled COVID Simplified and is joined by Dr. Karen Woolbright. She'll be helping us to identify the symptoms of COVID and what to do if we have these symptoms, if we test positive, and how to manage them. So again, we are using the Zoom app primarily to host this webinar, and it is also being streamed live via Facebook. So hello to everyone that joined us today. I want to start off by going over some of the guidelines for those who have registered ahead of time and are joined here in the Zoom session. So I'll walk you through the Zoom buttons and functions. First, we're asking all participants to keep your microphone on mute. So if you're joining from a laptop, you can see that in the lower left hand of your screen. If you're on a mobile phone, it's also in the lower left. So kindly keep it on mute so that our speakers will not be disturbed. Also, you have the option to keep your video on if you would like to be viewed. But that is up to you. You can also keep it off. Just remember that your video will be accessible by others joined in on the session. You can also send in your questions via the Zoom chat button. This is, and we have a team that is monitoring all of the questions that will compile it later to be asked. If you are watching on Facebook, you can simply just comment your questions below. And finally, to engage and to send virtual support to our speakers, you can send a virtual thumbs up or a clap using the reactions button in Zoom. So to sum up, please keep your microphone on mute. Make sure you are comfortable. We estimate our webinar will take around an hour. You may keep your camera on. You may also turn it off. And you can use the reactions or chat box feature in Zoom to interact if you have any questions or concerns. We would like now to thank our official media partner, Cebu Daily News, for helping us to promote this series. As Cebu's only independent digital news portal, you can follow them on Facebook for the latest local stories. Okay, so without further ado, I would like to introduce Dr. Mary Karen Woolbright. We're so lucky and fortunate to have her join us today. She is a very well-respected doctor based here in Cebu, and she has been publicly advocating for awareness about the COVID since it started here. She's very active on social media. She has a Twitter, she has an Instagram, and she really has a passion though for spreading correct and medical advice for how to deal with this. So she is a doctor of internal medicine with a subspecialty in clinical nutrition. So Doc, are you there, Doc? Can you turn on your camera? We're so happy to have you on the webinar today. Is Doc Woolbright there? So again, when Dr. Woolbright gives her presentation, you will be able to ask questions for her using the Zoom feature or the Facebook feature. Hi, Doc.
Hi.
Hello, Doc Woolbright. Good afternoon. Thank you again for joining us here on the webinar. So we're so excited for you to give your presentation on COVID Simplified. It will be to learn more about how do we identify the symptoms and how do we manage them if we do test positive for COVID.
Okay.
Yes.
Okay. Thank you very much for inviting me. I'm very honored to be here. Anything that has to do with education, I'm always open.
Yes, we're so happy that you were able to join us, Doc. We know that you've been very busy. You know, you still have patients. You're still doing rounds. So super grateful that you were able to carve out some time from your schedule to give us the presentation today. So without further ado, are you good to go, Doc, for your presentation?
Yes.
Okay. So again, if you have questions for Dr. Karen while she's giving her presentation, please feel free to chat in the Facebook comment box. You can also send your questions through the chat feature in the Zoom webinar. Okay.
So good afternoon, everyone. I am Dr. Woolbright, and today we will simplify COVID. COVID yan para sa mga sugbaron naka-blue ang pulo nga Bisaya. I hope this presentation will help you understand. I hope this presentation will help you understand COVID-19 better so we can find ways to help each other. What is COVID-19? Unsa nang COVID-19? For the past few months, you have heard of COVID-19, so I will be brief in defining it. It is an infectious disease o makatakod na sakit. Caused by SARS-CoV-2 virus, which is a novel coronavirus, meaning it is new. This specific kind was discovered only in 2019, so we have a lot to learn about it. This is the cause of the current pandemic that we are trying to avoid. Should we be scared? Angay ba mahadlok? We don't need to be scared, but we need to be aware and prepared. Why? Because it is preventable if we work together. Why is it a pandemic? Ngano salot man ni? Two things determine why COVID-19 is becoming a pandemic. First, how infectious it is, or what is called the basic reproduction number. Unsa kadali makatakod. Second, how virulent or dangerous it is. The number of people who die from COVID-19. This is called the case fatality rate. Unsa kadali makamatay. If you understand both, you will know why we are protecting you from COVID-19. So number one, the infectiousness of COVID, also known as the N naught, is simply the basic reproduction. Example, let's take a person infected with COVID. The basic reproduction number of COVID is 2. It means that this infected person can infect 2 other persons. And because COVID is novel or new, then every person can be infected. Everyone is susceptible. Simply, one infected person becomes 2, becomes 4, becomes 8, becomes 16, and so on. This also means that it could infect most of the population in a short amount of time. This will continue until it has reached a peak where there are less people to infect. Reproduction number varies based on the length of time a person is infectious. The reproduction also varies based on the susceptible people that they meet or the chance or opportunity to be infected. Removing one of these factors can decrease the risk for a pandemic. If infected persons are separated, susceptible people are sheltered, and unnecessary events are avoided. Thus, the virus cannot spread. It needs people and movement. Therefore, cooperating in prevention methods such as washing of hands, wearing of mask, and physical distancing also reduces the reproduction number. Now, isn't tuberculosis worse than COVID? Di ba mas makatakod ang TB? Let's explain simply. TB is more infectious than COVID, but it is not novel or new like COVID. So, many people already immune to it. Nakabala na. This makes spreading slower. Also, tuberculosis does not happen in 1 to 2 weeks like COVID. It takes months or years for the disease. Tuberculosis also has an effective and available medicine. Number 2, virulence. How virulent or contagious or dangerous is COVID? How many people die of it? This is called a fatality rate. COVID has a 2% case fatality rate. This means 2 out of 100 infected people die of COVID. It's not a lot, right? Let's check the numbers. The population of the Philippines is 106 million, and every year, 600,000 people die of non-COVID causes, which equals to 1,600 deaths a day. The COVID spreads very fast. So if we allow 80% of the population to be infected in the year, that is 85 million people. 2% of the 85 million will die. That is 1.7 million people, or 4,600 people daily. This is in addition to the 1,600 non-COVID deaths per day. That is 3 times the number of deaths. 2% is not so small when you count that way. But our COVID numbers are not this high. In the past 4 months, we had 52,898 cases, and as expected, we had 1,314 deaths, which is 2% case fatality rate. This is because we have been on ECQ, MECQ, and GCQ for months now. So the lower than predicted numbers are reflective of the quarantine status. Kay nag-quarantine man ta. Does slowing down the spread of COVID help? Makatama ba ang paghinay sa COVID? Why don't we just allow everyone to get infected? Slowing down the spread will not stop COVID now. It will only give time for hospitals to take care of the estimated amount of people who will get sick. COVID-19 causes mild and asymptomatic disease in 80% of those infected. 20% of them will be severe, needing ICU admissions. Now, the Philippines has only 70,000 regular hospital rooms and 2,000 ICU beds, most of them already occupied by non-COVID patients. Even if 10% of the Philippines gets infected, causing 10 million infections with 2 million severe cases in a year, that is still 175,000 patients a month needing hospitalization and ICU beds. We do not have enough. Decreasing the number of people who get infected at the same time will give a chance for the hospitals to take care of you if you get sick. That is the essence of flattening the curve. Mao ni ang pasabot pagpatag sa bukid, lowering the number of sick people so hospitals will not be overwhelmed. This line here is the capacity of hospital of the Philippine healthcare system. If we are above it, our case fatality rate will increase because we don't have enough facilities or manpower. If we flatten the curve below our capacity, we save more lives. So now we know the current situation, we are aware, let us now prepare. Kabaw na ta sa nahitabo, mag-alam na ta. Dear friends, please pay attention to the succeeding slides and save the numbers and instructions that will be posted. Mga higala, palihog paminaw sa mga musunod nga number o panahon nga ipakita. What are the symptoms? Unsa akong bation? Most of the symptoms of COVID-19 are fever or hilanat, cough or ubo, tiredness, kapoy sa lawas. Other less common symptoms are aches and pains o pamaol, sore throat o karat sa tutunan, diarrhea o kalibanga, even conjunctivitis or piska, loss of taste or smell, di maho, wala na'y lasa ang pagkaon, headaches, labad sa ulo. These are called influenza-like illness, ILI. Murag flu nga sakit. Ani. Serious symptoms include difficulty of breathing or hangak, chest pain or sa dughan, and loss of speech or dili kasturya. When a patient has difficulty breathing or hangak, they are classified as severe acute respiratory illness or SARI. So you have to take note of eating and sparing. Since there is already community transmission, even if you don't have exposure to someone with COVID, these symptoms will be considered COVID unless proven otherwise. If you have any of these symptoms, the first thing that you do is report to your room or call your healthcare provider. That is always the first thing that we do now in a state of pandemic. For serious symptoms, seek immediate medical attention. However, calling the hospital you plan to go will save time and effort in case there is no available room. Who do I call? Kinsa akong tawagon? Please make sure to save the numbers so that you are prepared if any of you or your family members have symptoms. All these numbers will be posted at the RAFI Facebook page and updated regularly in case you are not able to get copies from this slide. Now, if you have the mild symptoms mentioned previously, you can contact your respective cluster clinics or fever clinics. Visit the assigned one close to you. A cluster clinic is an available clinic in your barangay that will attend to all your COVID or non-COVID symptoms. You may also call any telemedicine platform online for a free or paid consult. And if you prefer, some private doctors still hold clinics, but you must also call them for an appointment. What are the hotline numbers? For Cebu City, the cluster clinics hotline numbers include these two cell phone numbers and a landline. For Mandaue City, they are divided into the North District contact numbers with Sun and Globe numbers depending on the barangay, Central District contact numbers, and the South District contact numbers. The Talisay numbers are as follows. And the Lapu-Lapu City contact numbers for COVID hotline, City Health, Transport hotline, and General hotline are as follows. Here are the numbers of the hospitals. In case you have more severe symptoms, please contact the tertiary hospitals for immediate medical care. Why do we need to call first? We do not want that you will be inconvenienced by traveling to another hospital because it is full. We do not want that you will have to wait a long list in an emergency room where there might be other emergency rooms with a shorter line. So where do I go? Asa ko mo? After calling, you will be directed by the operator to either home quarantine or go to an isolation center or a quarantine facility. It is better for people with mild symptoms to stay home first and isolate themselves from their family as well as other people until they have been checked by a healthcare professional. Is there medicine for COVID? Naabanit tambal. Now the answer is no. However, there are many drugs that are made for COVID that is under testing. And that's why we should always go to a tertiary hospital for consult. How can I help? Unsaon ako tabang? One of the things we can do is to donate convalescent plasma or blood from recovered patients. If you know people who have recovered from COVID, they can help with the recovery of critically ill patients. We are calling on all recovered COVID patients to donate blood. How do I protect myself? Unsaon pagpanalipod? The three basic rules for COVID protection is still the same. Wear a mask, wash your hands, and do physical distancing. I hope you learned something from our COVID Simplified. Salamat.
Thank you very much, Doc Woolbright, for your informative presentation. No, if you can you turn on your video, Doc? Okay, there you go. Hi, Doc. Thank you again for joining us this afternoon and for that presentation. No, it was very interesting that what really stood out to me, no, is that 80% of the cases are actually mild and asymptomatic cases. So these are symptoms that can be managed, no, on our own in isolation, if possible, di ba, Doc? Or in an isolation center. So we have some questions that came in, di ba? First, you mentioned, Doc, you should call ahead of time for the hospitals. Kaya we know we've been hearing that overwhelmed on hospitals karon, but what are the symptoms you need to exhibit to, when is it absolutely necessary to go to the emergency room versus being able, what kind of symptoms would one be exhibiting?
So it's very difficult to adjust now because before, if you feel anything, you just take the car, you take the public transportation, and you go to the hospital. Right now, we have to rely on phone calls. So we have to really make sure that we know where we're going. There is no public transportation. Hospitals are full. You have to call. You start calling when you have mild symptoms. Don't wait until you have severe symptoms. So if you notice, cluster clinics are for mild symptoms. These are the places you can go to if you feel uncomfortable but still okay. If, of course, it's a severe symptom and you know you need to go to the hospital, you have to call the hospital you will go to. Some of the hospitals now, the emergency rooms, have a wait list of 50 to 100. So, but some would have 20. So even if it's farther, if you call, you will save yourself a lot of people in front of you. You will save time and traveling and going from one hospital to another. Anyway, one phone call will probably take 5 to 10 minutes versus waiting hours because the line is long. So that's why basically the first thing now is call. Where you want to go, what you are feeling, just call.
Okay, so point is clear now. We really need to call ahead of time to make sure that, or to check what's the wait list for the hospitals, because some may be more than another, and to avoid having to wait, no, if we're not feeling well already, having to delay further the treatment. No, so point noted, Doc. It's really important to call ahead of time. Doc, there's also some questions about the symptoms, no, and it's how do we tell the difference of symptoms from, for example, like fever or cough that may come from a common cold, as well as symptoms that would be caused for COVID. Kaya syempre, it's rainy season right now, and sometimes our bodies are prone to feeling a little bit under the weather right now. So how do we really distinguish maybe a common cold from COVID-19?
That's the difficulty of COVID. The symptoms are very similar to the common flu, to the regular flu. So you cannot distinguish. You just have to take care of your body and have a teleconsult, a call, or a cluster clinic checkup so that you can be assessed properly. Only swabbing or rapid testing will be able to show if you are really or you have a current or a past infection. So most of the time, if you cannot do the swabbing or the rapid testing, for mild symptoms, isolation is warranted for this, even for children, for healthy adults. But once the symptoms do not improve or become worse, you must get tested. And if you cannot be isolated, we have barangay isolation centers and quarantine centers so that you can be separated for at least 14 days.
Okay, sige, Doc. So noted the importance of communicating with your local authority, whether it's the barangay or the city, so you don't necessarily have to go directly to the hospital if you're exhibiting mild symptoms. But if they are those ILI symptoms, it is recommendable to go to those cluster clinics so that they can further assess. We also have a question, Doc. For those that have tested positive already for COVID, is it possible to have to test positive again even after you've recovered? What could possibly trigger the recurrence of the sickness?
COVID is a new disease, so we don't know a lot about it yet. But most of the viral illnesses of the same kind, if you have already infection, you will be immune for life. COVID, though, is a zoonotic virus, meaning it's naturally not for humans. It's closer to animal viruses. And so, because of that, maybe our bodies cannot create a long-term immunity, which is why our convalescent plasma donors or the people who donate blood for COVID patients must donate their blood within a month or two after they recover, because after that, apparently their titers will go down.
Okay, so is it possible then, Doc, if you already test negative for COVID, is it possible to still be contagious? Are you at risk of spreading COVID to other people if nakadawat na ka og negative? If you've already negative na result, you've already been cleared medically. Is it still? Are you still contagious? Should you continue to quarantine?
So there are two tests for COVID: the swab, which detects the virus itself, and the rapid testing, which detects the antibodies from the virus. So if you test positive for the swab, most likely you really have COVID. But if you test negative for the swab, there's still a chance it's a false negative. So if you have symptoms very likely to COVID, X-ray results, CT scan findings, based on your doctor or your physician's advice, you will be treated as such. No? So physicians will still look at the person and other parameters before deciding if it's positive or negative, because it is not 100%. No? There is a specificity and a sensitivity for the test itself. The rapid test, on the other hand, also does not test active disease, but rather exposure to COVID. So it really depends also on the test.
Okay, so Doc, I think no, even if you do test negative, and actually for everyone involved, no, it's good to practice good hygiene, practice personal protection such as wearing a mask. So can you clarify, Doc, what is the proper way of wearing a mask? Is there a difference between a cloth mask or a surgical type of mask, or what is the ideal thing to do to protect ourselves? We know nga, if you're working in a hospital or you're a frontliner, for example, you're more at risk, so you really need the medical grade. But for us that are just staying at home or maybe doing some essential errands, what is the best way that we can protect ourselves when we have to go outside, you know, to buy groceries or to do, you know, go to the bank or other things? What are the things we should be doing to ensure that we're protected?
So the mask is the number one essential that you must have on before you leave the house. Now, most of the Asian countries have very low transmissions because they have started mask wearing early. Even European countries that have advocated wearing of masks have shown decreased transmission. So it doesn't matter for the community setting if you wear a cloth mask or a surgical mask, because in the community setting, it is open air, so there is no, the virus doesn't stay long in the air. But in the hospital setting where there are 4 walls and the virus can linger in the air longer, then it is suggested that you wear a surgical mask or a medical mask. These masks are meant to really filter viral elements, and these masks are most of the time disposable because there is a higher chance of you getting a virus in a hospital setting compared to when you are just outside in mall, or well, we don't have a mall, but outside in outdoors.
Sige, Doc, so while we're talking about reducing our exposure to the virus, now let's just talk about for us everyday people na we're going out or just going about our daily business. Is it true, Doc, that exposure to the sun will kill the virus? So if it's, for example, very hot, it's a hot day, are chances of contracting the virus less?
That's a very good question, because the virus, when you talk about the virus being killed, you have to ask, is it inside the body or outside the body? Now, the virus outside the body can easily be killed. It can be denatured because it's not really, it's questionable if it's really alive, no? But it can be easily destroyed. Alcohol, chlorine, UV light, washing with soap and water, you can kill the virus right away. Certain temperatures outside the body can also kill the virus. But when the virus is inside your body, it also invades your cells. And so it's now a different process. When you put alcohol in a cell, the cell will not absorb the alcohol. The cell will not absorb the sun. So if you have a virus in the street with sunlight, at the temperatures that we have here in the Philippines, it will probably die. But if you are infected inside your cells of your body with a virus, being under the sun will not kill that virus, because the sun will not penetrate your lungs and your blood vessels. So there's 2 different ways. You have to ask, inside the body or outside the body. On the surfaces, outside of a living organism, the virus is easy to kill. But that's why we always say that a lot of alternative therapy probably can kill the virus before it enters the body. If you steam an item that's called in vitro, the virus is outside the body, then you can kill the virus. But you cannot steam your whole body because the steam does not penetrate the blood vessels. It doesn't penetrate the cells where the virus is. And so many of the things that we think can kill the virus outside of the body does not actually apply when it is already inside.
I see, Doc. And so going off of that, no, you were mentioning steam. And I think one of the popular, methods right now as being touted as a remedy for COVID-19 here in Cebu is tuob, which is like a steam inhalation. No, so what is your take on this, Doc? Is this an effective way to alleviate symptoms of COVID?
So COVID has one of the symptoms of COVID is desaturation, or your oxygen levels are very, very low. So these people with low oxygen saturation don't know that they have low saturation. And sometimes they want to feel better by taking tuob or inhalation tea, mga steam Vicks, like that, no? And they probably feel better at the beginning. But if you do take that, you have first to know that it is not going to kill the virus. It will kill the virus on your face, in your nose, but if the virus is already inside your body, that's not going to be effective to go and penetrate the blood vessels, the deeper parts of the lung tissue that where the virus has attached. No? The virus attaches to ACE2 receptors. Now, ACE2 receptors are present in the lungs, but they're also present everywhere else in the body, including the blood vessels. Now, the steam tuob does not go in the blood vessels. The blood does not contain air, so it will give a false sense of security to these people that they feel better. So now they're not infectious, I'm cured. So if you do take tuob, since we've been practicing tuob for a long time, the Philippines has, then you have to know that you should still do it alone, in isolation, careful, and that you will still be infectious. If tuob really cured the virus, believe me, Donald Trump will now promote it all over the USA.
Yeah, so that's good, Doc. So to clarify, no, tuob is more like a therapy, no, to make you feel better if you're exhibiting these kinds of symptoms, but it's not a cure. So you still need to ensure that you are continuing isolation and continuing any other medication prescribed by the doctor. So it's really something to add on to the routine, no, to relieve some symptoms, but not to cure COVID per se, Doc, no? And so, Doc, we have another question that is, I think you would be able to answer this as a doctor. It's, hi, Doc, does a dengue fever survivor and at the same time COVID survivor, are they still able to donate plasma? So they've already survived dengue as well as COVID. Can they still donate plasma?
For what we need now are plasma from COVID survivors. We don't use plasma for the dengue survivors for their immunoglobulins or the plasma of the dengue to treat dengue. So, but we are trying to use plasma from COVID survivors to treat critically ill COVID patients. It doesn't matter if you also had dengue before. It's okay, you can still give as long as you have a high immunoglobulin titer. So they will check how much immunoglobulins your body made after you got infected with COVID. Because some people, they still don't make immunoglobulins against COVID. And that's why sometimes even if they survive COVID, they might not be eligible to donate plasma to help another person with COVID.
Okay, so you just still have to go through the screening, no, and they'll be able to tell you whether or not you can donate. But it is good to get screened because I know a lot of people, especially here in Cebu, are in need of plasma, no. So highly encouraging any COVID survivors to get yourself screened, and if you are eligible to then go ahead and donate that plasma, okay, it could really save a life. And then this will be my last question, Doc. We're running out of time, but what is a realistic timeline for a vaccine to be available for mass production?
You can never really tell because it's not really a regular. It's not an easy thing to do. Make a vaccine after you have to go through a lot of tests, and then when you try it to a person, you have to. It's called clinical trials, no? And if there are side effects from that vaccine, then it can be postponed again because you don't want to make a vaccine that causes more harm than good. Also, you don't want a vaccine that is ineffective also, wherein you pay for something that doesn't also work. So most of the vaccines, imagine the vaccine for dengue took about 10 years to make. Until now, we don't have dengue vaccine. Of course, we do have flu vaccine, and every few years they upgrade it to include new strains. But for COVID, it's not a regular flu. It's really a novel coronavirus. So we don't have that kind of vaccine yet, and there is no timeline. So we just have to hang on and help each other, and we will be continuing these new normals for a long time.
Yeah, so thank you so much, Doc. No, I think those are all the questions that we have time, but I wanted to ask you also, what do you feel is if you could communicate one message to people here in our community about COVID, what would be that message, Doc?
I think it is be kind. Everyone is stressed right now. Be kind to the people you meet in the street because you could give them COVID. Be kind to them because they might have COVID and you may be asking them for help later if you need convalescent plasma. Be kind because everyone's plans are out the window. So everyone is frustrated, and it's not intentional for people to spread false or fake news. Sometimes it just happens. So understand more, and just, we're going to be in this for a long time. If we don't start being kind right now, we will have, it will be more difficult. So we just have to hold on and be kind.
Yes, I think that's a really good message, Doc. No, kindness. No, kindness is the root of all of your actions. Whether that's being kind to yourself, taking care of your well-being, being kind to others by wearing a mask when you go outside, or being kind when you're interacting with people. Because as you said, I think everyone is feeling a little bit of stress and anxiety. This is really an unprecedented time for all of us. So I really appreciate that message, Doc, and thank you so much for joining us here today. I think you provided a lot of insight. You brought us back to the basics of COVID, and really gave us a thorough understanding. So as we move forward, we're reminded what we need to do to take care of ourselves, or what symptoms we need to look at in, to recognize if we could possibly be positive. So I'll just summarize some major takeaways that I gathered from your presentation, that I would like to highlight. The first being that COVID it's a communicable disease, and it's the rate at which it spread really depends on us and our practices, so that depends on you staying home as much as possible to mitigate that risk. And if we do need to go out for essential errands or essential tasks, we need to be in full PPE with a mask, face shield, if possible, to help flatten the curve. Because while COVID may be here a long time, the hospitals may not be able to cope up at the rate. Our hospitals and frontliners are finite resources, and they're already overworked. And so also I want to highlight, hospitals are for when we are really feeling ang symptoms, diba, Doc? We should, if we feel like we just have some mild symptoms, we should coordinate first with our cluster clinic in our barangay or at the city level before going directly to a hospital, because they're already overwhelmed and finding it difficult to cope up as is. So I think those were points very well taken, and Rafi has been posting the contact numbers of cluster clinics in Metro Cebu, and we'll repost that after the webinar, Doc, as you mentioned, so that people can easily refer to that. So you can feel free to share those and spread those. That is public information that we would like everybody in Cebu to know. And I would really like to again thank you and express gratitude on behalf of Rafi, Doc, for you joining us today. Since COVID is a new disease, there's a lot of uncertainty about it, but as a medical expert, as a medical doctor, your presentation today provided so much insight. So thank you so much. I'm sure a lot of people found it very helpful, Doc. You did a great job. I would also like to thank the viewers and remind everyone that we will be having a second webinar next Friday. This time we'll be interviewing 2 COVID survivors and learning what it was like for them to go through, so we can try to understand what happens when someone actually gets COVID. And so please stay tuned for that. We'll be posting more information on our Facebook page in the upcoming days, and you can also register and tune in for that by next Friday. So in line with Rafi's vision of touching people and shaping the future, we hope that our session today has made you more aware of what we can do in the midst of this pandemic and how we can move forward together confidently. So thank you so much for joining, and remember to stay safe. Have a great weekend, everybody.
Thank you.
Thank you, Doc.